Well, I'm really fortunate to get involved with stem cell therapy. I got involved, I did my practice here in the United States, and I came back to Panama 5 years ago. And throughout a friend of mine who's a doctor who was looking, he had a heart condition, and his mother died at a young age, her sister died at a young age, and he was heading for that same direction and looking for options. He found at that time the clinic in Costa Rica and Dr. Riordan, and he got treated, and he improved dramatically. And he called me one day and told me what he was doing. And as most physicians are, I was really ignorant of what stem cells were all about and what they were doing. But I was impressed when somebody I knew had this treatment and improved so dramatically. And so they came, and I met with them, and I was blown away. And as Dr. Nocera was saying, it's amazing how much this science has advanced in a recently young time. And still, how can you expect to know a lot if even physicians are so ignorant till today about it? So I was overwhelmed about it, and I said, we got to do something. And thankfully, you know, we did a lot of research in Panama and found there was a law against embryonic, but in favor of adult stem cells. So that was obviously very helpful. So we went and did all the diligence that had to be done to get that approved and done in Panama, and we did. And so we were really fortunate that we had a more open-mindedness in a government, in a country where, you know, we have thrived and grown a lot in the last probably decade. So that, for us, was really important that we can do what we're doing and progressing and having, you know, in our country something that's so amazing. And that's really how I got involved into all this. I'm going to talk today briefly about really the rationale of why these adult stem cells work. A little about the history, what's currently happening, the type of stem cells, Dr. Nocera talked already about them, and how they decrease with age and how we can benefit from them overall. The history of Medistem, it was opened in 2006. We expanded to Panama in 2007, and we consolidated operations in Panama because of what I just told you, and we're continuing to grow there right now. The lab is in a unique place in Panama, which is it's a city of knowledge, which is a techno park that promotes growth of any technological company. So we're really fortunate to get accepted there. We had to send our applications and go through a whole process of evaluation, and that's really where the magic happens. You know, it's really where the cells are grown and everything is produced, and we're really proud of that facility. And then Stem Cell Institute is a clinic that basically provides the services for where Medistem produces the cells. This is where we at in Panama City. You know, I always want to show this picture. A lot of people think of Central America, like, where am I going? Well, it's a big metropolis, as you can see. Probably we've grown too much for my taste. And obviously, the Panama Canal, we can't go without saying. Clean rooms are where, again, the cells are produced, and that's really, again, we follow state-of-the-art American standards of care for the care and treatment of the cells. So that's really important for a lot of patients to know that this is high quality and that we follow strict guidelines of control where these cells are produced. This is simply a flow cytometer where the cells are separated. This is one of the lab technicians who's doing that, and we have, you know, we're really fortunate to have a great personnel in the lab, and that for us is really important that we were lucky to get people who are really dedicated to the advancement of the stem cell therapy. And this is the lab in Panama. So we have 4 doctors in-house. We have many doctors that work with us that do the procedures like the bone marrow extraction or the liposuction where the cells from the fat are obtained. And so it's really important to work as a team, and that's what we've had. Sources of stem cells, embryonic, which were touched already, and fetal, we don't have anything to do with that, and we really don't use that at all because of everything that was recently discussed. We work with what we call adult stem cells that are from the umbilical cord, from the placenta, the fat, the bone marrow. Teeth is another source, but it's clinically at this point not used. And menstrual blood has been used with really good success also. So the adipose comes from the own patient, the bone marrow comes from the old patient, the umbilical cord and the matrix from the cord are used, and these are from healthy donors. So as Dr. Nocera was saying, what we found is that the bone marrow and these other tissues that I just recently talked not only had the blood-forming stem cells that helped in conditions like leukemias and these blood malignancies, but we found that it has these cells that help repair, these mesenchymal stem cells that really were the key of finding out that they helped in these other conditions. They home to the areas where there was damage, and they help to reduce the inflammation. The common denominator of all these conditions that we treated, there's inflammation, there's damage, and that's really where these cells come into play. They go to those areas of damage, and they help to reduce that inflammation by directly repairing and by producing a lot of these factors that we are understanding more and more, that a lot of the benefits from adult stem cells is really these trophic factors that we call it, that they secrete, like those cytokines that Dr. Nocera was showing. So all these anti-inflammatory factors is what we're looking at that make a big difference into why they help in these medical conditions that has been shown to adult stem cells to be beneficial. So they can help the immune system, and that's also a big condition that happens that patients have in many of these patients that come in. The immune system is not working well. The immune system attacks them like in multiple sclerosis or rheumatoid arthritis, and so controlling the immune system is really a key factor that helps these patients improve, and that's one of the things that we have found that adult stem cells can do. I think the analogy of a bank account is really a key thing of understanding what happens with the aging process in general. As Dr. Nocera was saying, we all have stem cells in our body that helps us with combat infections, diseases, etc. Unfortunately, it's a steady decline the moment we're born to when we are 30 or 40. So the ability to repair ourselves is significantly limited, even if, just by being healthy itself. So once we have a condition like a heart attack, a stroke, a cancer, you deplete your stores that already dwindle down, so your ability to recover from these diseases becomes significantly affected. And then when you're out, there's really no way to restore that. And that's what we're understanding more and more, why these conditions or diseases affects some patients more than others. Some patients have the ability to mount a response by the stores they have in stem cells, and some don't. So it makes kind of sense that if you're depleted, improving the odds of your disease to be controlled will help significantly if adding these stem cells that your body already is not producing. This is a sketch on the bone marrow. Just look at the amount. This is per 10,000, 1 in 10,000 when we're newborn, the amount of stem cells that the bone marrow has, and look how significantly the decline occurs even when we're a teenager. 1 in 100,000, and we're 80 years old, it's almost non-existent. So that is a real issue. We are basically depleting ourselves the ability to repair. And this is simply another sketch showing the total cell reserve in our body when we're born, and see how significantly it drops down. So these adult stem cells, these mesenchymal stem cells, are found in every small blood vessel in our body. They simply, again, start declining with the aging process itself. We found several years ago the ability, and most of it through, again, a lot of the animal studies done by Dr. Harmon, and that the fat had this significant amount of stem cells that were lying dormant in our body. And that by removing the fat and obtaining that fraction that had the stem cells made a significant benefit in patients' recovery in a lot of these autoimmune conditions like multiple sclerosis, rheumatoid arthritis, osteoarthritis, etc. So we found that it had a significant amount not only of these mesenchymal stem cells that we were talking about, but it had other type of cells inside them that will help also with the healing process. So what's the active problem in a lot of these autoimmune conditions is these cells that our body produces, these activated T cells, clone themselves and then attacks our body. And depending on where the condition is, like in rheumatoid arthritis, it attacks the joints. In multiple sclerosis, it attacks the central nervous system. So you have these cells that are producing and reproducing and attacking your body. So based on that physiologic reasoning, the rationale is that a lot of these conditions are immunological first. That both multiple sclerosis and rheumatoid arthritis is that deranged immune system that keeps attacking you that produces a lot of the clinical features that you develop. So controlling, again, I can't overemphasize that point, controlling the immune system is really a lot of most of the benefits that patients receive and when they respond is because we're quieting down the immune system, and we found that these cells that the fat has, it produces those factors in significant amounts. So again, the rationale is that these cells control the immune system, that they reduce the inflammation again, and these T regulatory cells are other group of cells that are found in the fat that have that ability also. It was really important, when I got involved into this, is looking at the science of what we're doing, and that's something I really feel proud that we've pushed a lot into recollecting our data and following up our patients and publishing, because that's really, at the end of the day, in medicine, you need to have the things black and white. And we're pursuing that, and that's really what differentiates us from a lot of groups, is that we're truly looking at the evidence that we're seeing in our patients and producing articles, and this is one of the many that we've done, and showing the benefits in this specific case about the fat and the ability of it to heal in the conditions we're treating. I'm not going to go through this. I think we talked already about the immune system. This is another publication that we did about multiple sclerosis and the one in rheumatoid arthritis. This is another article that we published. And then in the article, it talks about the case reports we did and the significant benefits they have. This is another article on rheumatoid arthritis. Spinal cord injury is a condition that we have dramatically seen results in the last several years. And we're really excited and proud that because of the results we are getting, we've been able to work, and we're starting to collaborate in a study with the University of Miami, the Project Cure for Paralysis. It's pretty much the biggest group doing spinal cord injury, and they saw and looked at our data, and they were really impressed that the center has had the results that we were getting with our patients. So they came down to Panama, and they reviewed everything we were doing, and they were amazingly surprised and frustrated. Again, really stating what Dr. Nocera was saying. They've been working with trying to do studies with adult stem cells in spinal cord injuries, and the FDA kept putting roadblocks and not allowing them to pursue this therapy. And talking to Dr. Barth Green, which is the head of that group, he was really so frustrated, and unfortunately that's what's happening in the United States. A lot of these studies are ongoing, but they're really small. But I think the evidence is overwhelming. I think at the end of the day, this is something that's going to be approved, but it takes a long time. So he came down and he was really blown away what we were doing and the seriousness of how we were doing it. And so we're starting this collaboration with him and other groups to really get the things black and white and produce the data that all the medical community eventually needs to see. We're seeing it every day, but having it in a publication with a group with so much experience for us makes us really proud. And this is just a rationale of studies that have been done already with spinal cord injuries in animal studies. This is another case report that we did on the feasibility of using allogeneic, which means cells from donors, in this specific case from umbilical cord, into treating spinal cord injuries. So the safety, obviously, is really important in medicine. Do no harm. That's our Hippocratic oath, and we really follow that. And that is the key of what we can really guarantee to patient, that this is a safe therapy. We can't really guarantee that this is a definite cure, because it's not. You know, some patients do really well and some don't do as well as we would expect them or like them to, but it's really safe. And there's enough evidence in the literature and by our experience that this is a safe therapy. And the fat has been studied again in animals, as we talked, in more than 8,000 animals that have been treated, and very few side effects reported. A lot of horses, dogs have been treated with these multiple conditions, and again, unfortunately, it can't be done in humans, but it's been proven to be very effective in animals. Dr. Robert Harmon from San Diego has been really the pioneer in this treatment, and it keeps growing. So we know it's safe in animals, and also in humans. We've done more than 850 patients now, and more than 800 IV infusions with the fat-derived stem cells with really minimal side effect. We've had some pain sites of infusions, just one case of venous thrombosis when we gave a high dose, flu-like symptoms, and mild allergy reactions. We're also excited, this safety analysis by the University of Indiana, they came recently to our center and reviewed more than 100 of our patients for safety purposes, and this is something that's going to be published soon in an article about the safety of infusing stem cells from the fat. The umbilical cord, I think, is mentioned before. There's been thousands of transplants in the U.S. for bone marrow reconstitution. And I think the key get-home message of all this is that these cells are immature enough, and there's been enough evidence to show that they don't exert a rejection like an adult tissue has. And the precedent of every mother that Dr. Nocera mentioned has every baby's stem cells carry, so we know that this is a natural process. So that's why we feel really comfortable that the body is not going to reject in the cases where we use donor cord bloods. I think the issue of why it can't be done in the U.S. was touched already. The procedures typically are intravenous. Some are applied in the muscle, some are applied in the spine, and some are applied directly into the joint, depending on the condition. And in some rare occasions, we use catheterization when we have to access directly the kidneys or the pancreas. Just briefly, going to talk about some of the conditions that we treat. Arthritis, the patients typically stay 10 days to 2 weeks, and we do a mini liposuction. And typically, we obtain 500 cc's of fat, and then that is separated in the lab. And we obtain then the fraction of the stem cell, which is really what works there. And why the patient has to stay that long? Because, and that's a problem. In the US, you can't take the fat and apply it in a one-step procedure. But what happens if you apply it IV after you just did a liposuction? Those cells are going to go to the area of inflammation you just created by the liposuction. So that's why you have to wait typically a week for that inflammation to get reduced, so then you can apply the cells IV. And also, obviously, you apply directly to the joints involved. We've had really good success with arthritis. Multiple sclerosis, again, we've talked about it. Quite often is a disease, again, that affects many organs, but it's an immunologic condition primarily. The patients stay longer because there's a lot of cells that we apply, not only IV, but we use the intrathecal or the spine route because, obviously this is also a neurologic disease. We've treated probably over 200 patients now, and we've really had probably 70 to 75% success rate. Different types of MS, and there's definitely some that are more aggressive than others. We have found that relapsing remitting, which is one of the types of MS, responds the best. Secondary progressive also, but is not as effective on patients with relapsing remitting. But again, each case is different. Some people have some dramatic responses, and some have had mild to moderate, and it can take longer in some patients, but the benefits are there. Some patients have to come back because of the nature of the disease, and when they come back, they get significant benefits 6 months later. All these autoimmune conditions that we talked also behave the same way. Typically, the source, as we talked, for autoimmune is the fat. Spinal cord injury, again, is one of these conditions that is pretty dramatic, and we've had really good success with what we're treating now. Basically, I'm not going to go through all the cells that we apply, but what we know is the younger, obviously, the patient, the better outcomes. The sooner from the lesion that you apply the cells, the better results. Even though we've treated a patient that had an injury more than 8 years, I think it was 10 years actually, and he responded dramatically. And those are the things you can't predict. This patient probably had already stem cells in his body that were just waiting to be activated, and that's probably why he benefited that dramatic. But in general, what we have seen is that, again, the sooner you get him, the better response. And what I talked about, the university, the collaboration that we're doing with the University of Miami is something that we're really excited. Heart failure, again, that's the condition I really got involved into all this. It's obviously a devastating condition that affects the heart ability to pump blood, and a lot of these patients are significantly affected. We have found that, again, these cells travel. They travel to where there's damage, and we have applied them just using the intravenous route. And by using this special type of cells, we have found, again, that in really 17 out of the 19 patients at that time, we treated more now, there was significant improvement. And it was pretty objective. And with heart failure, you have an echocardiogram, which measures the pumping ability of the heart that you can do before. And then we measure the same echocardiogram after therapy, and we saw objective results. So we're really excited about this condition that can be very devastating in a lot of patients. Autism is obviously a very devastating condition in a lot of children, and we published a paper more than 3 years ago about the rationale of why stem cells or adult stem cells could work. And we have found that there's a lot of areas, regardless of what the original offending agent was, the theory is that there's a lot of areas that were decreased blood flow to areas of the brain, these CD34 cells that were talked before. And there's a problem with the immune system in their gut. And these MSCs, or the mesenchymal stem cells that we talked about, help, again, with the immune system. So if you improve the immune system and you improve the blood supply to the areas of the brain which are not working well, again, because of inflammation, seems logical, physiologic sense that it would work. And that's what we have been seeing in the more than probably 150 patients that we're treated now. And so we're really excited, again, that we're going to be starting a clinical trial in collaboration with NYU, very likely, because, again, they reviewed all our data, and they were impressed that we've been seeing these results. So that's also something that makes us very proud that we can collaborate with these strong university programs that are really pushing. So there is definitely interest in the U.S. of getting adult stem cells forward. And, but again, unfortunately, a lot of limitations because there's no money. Again, no pharmaceutical company. So a lot of these companies are sponsoring through foundations all these therapies, which is the sad part of all this. So the patient application protocol is important to tell people, again, that we review every case that applies. You know, we have a medical review board that discusses every case that we get because, you know, we get many applications that, you know, some devastating condition, but there's really no evidence that stem cells would help in those cases, and we, you know, unfortunately decline them. And that, for us, is really important to be objective and be truthful to patient when there is no benefits there. When we've collected so much experience in the patients that we've treated, so we know what works and what doesn't work. And we're obviously all learning. This is definitely a field that it's in its infancy, but it's grown, I think, exponentially in the last 5 years. So we are really always looking at ways to improve the outcomes in patients. And we're really, for us, it's really key, the safety. So those are things that we thrive for. So once we review a case, we take it, you know, deeply into looking at what the objectivity of this, and we are realistic with the patient when we say, well, we feel that you are a good candidate, or we simply feel it's not worth considering this therapy. So just to finish up, I think really adult stem therapy seems to be a very useful condition for regenerative medicine. I think there's definitely a lot that we are learning about it, but there's no doubt in my mind this is, first of all, a safe therapy, and it's really not a miracle cure, but it can help significantly in some patients, and it's no doubt in my mind the future of medicine. We're going to hear more and more about it, and we feel, again, really fortunate that we're doing, you know, I feel, again, a pioneer in this therapy, but our objective is not only educating patients, but really educating doctors so they are aware of this is definitely an option that they have to look into because the evidence is there. It's scattered, but it's there. But unfortunately, a lot of people are blocking it. They're saying, well, there's no evidence that this works. You shouldn't be doing this. And the more I get into it, the more it just makes our day when we see some dramatic improvement. So we know we're heading in the right direction. And I think the evidence is going to be overwhelming. So hopefully in a very near future, this is something that's going to be available here in the U.S. So thank you very much for your time. And